Assalamu alaikum, this is Shama Zara, and today I'm going to discuss a very important topic of cardiology, acute pericarditis. And basically, the main focus of my discussion today will be that how you can easily recall and memorize the causes of acute pericarditis, as they are many. So, let's starting our discussion. First of all, we should know that what is acute pericarditis. What is acute? Acute means something which occurs rapidly within 24 hours, very early response and very rapid response, that is called acute. Pericarditis. Now, very important point, just remember it throughout your life that wherever in your whole study points, especially medical, the word itis comes after a structure. This itis, it exactly and very clearly indicates that there is some inflammation. Fine. So itis indicates inflammation, and this pericardium or pericard, it shows pericardium. So basically now it is clear in our mind that it is the inflammation of pericardium that is called acute pericarditis. Okay. Now to remember the causes of acute pericarditis, I have made a mnemonic. Just imagine a line or a sentence, it will help you out in recalling this whole mnemonic, that I presented a presentation on acute pericarditis, and my sir, whose name was Amit, he gave me a cup as a reward. So it's just a straight sentence to link the mnemonic with the disease called acute pericarditis. I repeat, I presented acute pericarditis presentation, and my sir named Amit gave a cup to me as a reward. So the mnemonic is cup of Sir Amit. Fine. Now each of this word which I have written in capital will indicate a cause of acute pericarditis. Fine. Starting with C, what does this C indicate? C indicates collagen vascular diseases. Now what are these collagen vascular diseases? These are sarcoidosis, systemic lupus erythematosus. I'll write with another marker, just a second. Collagen vascular diseases, they include systemic lupus erythematosus, then sarcoidosis, rheumatoid arthritis. So these are the causes, one of the cause of acute pericarditis. Moving on to the second, if you write this U, what does this U indicate? U indicates uremia. Uremia. So make it a yellow, sorry for the markers. U indicates uremia. So uremia is a cause of acute pericarditis. Okay. Then this P. This P indicates any post viral. So it tells that acute pericarditis, it occurs after a patient has undergone or was having post any viral infection. So after it, acute pericarditis occurs. Then is this S and R. Now this is, S is for any surgery, so it also occurs after a surgery is performed. This R indicates after any radiation therapy. This I, no, very important, we know that whenever there is infection in our body, it causes inflammation. So this I, it shows infection. Now we know infection is because of pathogens, and pathogens are usually either, I'll write it with green, either viral may we have, very important, hepatitis A or B, or the HIV virus, Epstein-Barr virus, Cox-Secchi virus. These are the, and etc., more viruses too, but these are the main viruses that cause acute pericarditis. Talking about the bacteria which cause it, TB, very main, tuberculosis. If a patient is having tuberculosis, it can have acute pericarditis, or it can cause acute pericarditis. Some toxoplasmosis, toxoplasma, which is a parasite that can cause it. I'll write toxoplasmosis here. So these are the whole causes, or even some of the fungal infections, they can also cause acute pericarditis. Now talking about this Amit, what does it show? That this amyloidosis can be a cause of acute pericarditis. Now this MI, consider this MI collectively, it is myocardial infarction. Now there are 2 points in it. Either the myocardial infarction, I'll write it in any other color, either myocardial infarction can be acute or after some days, like imagine after some weeks, 2 months. Now immediately, if a patient is having acute MI, within first 24 hours acute pericarditis can occur. And within first 24 hours acute pericarditis can occur, and after 6 weeks to months in case of Dressler syndrome. Fine, these are the causes. Then whenever 2 T's come in, the cause of any disease, so mostly it's not a rule, but you can remember that it can be either trauma or tumor. So this T, it denotes any tumor. And tumors, now which kind of tumors? Lung cancers, most commonly these are end stage lung cancers, so you can write lung cancers or breast cancers, etc. They can cause acute pericarditis. Fine. Then talking about this last T, it shows trauma. So if there is any trauma to the chest of the patient, it can also cause acute pericarditis. This was a brief video which I made just to help you guys in remembering the causes of acute pericarditis. Just a brief overview. I have made a mnemonic for it, a summary of the whole discussion which we did today in just a minute. Mnemonic is, I presented acute pericarditis presentation and my sir named Amit gave a cup of rewards. It's just a line to link the mnemonic, which is cup of Sir Amit, with acute pericarditis. C for collagen vascular diseases, U for uremia, P for post-viral, S for surgery, means after a surgery, I for infection, which can be the viral, bacterial, toxoplasmosis or fungal, R is radiation therapy, means after undergoing any radiation therapy, acute pericarditis occurred. MI is myocardial infarction, A is amyloidosis, T for trauma, T for tumor, most commonly tumors are end stage lung cancers. In MI we have 2 types, either acute or after 6 weeks to months in case of Dressler syndrome, or within first 24 hours, that is acute MI. Thank you so much. I hope you liked the video. I hope it helped you out in memorizing it. Please like, share and subscribe my channel for the latest updates, as many of my videos are coming forward. At the end, I'd like to thank my worthy teachers who helped me a lot, inspired me a lot, and as a result, I'm at this position of helping others. I have that passion to help others and make medicine and other even our study topics easy and understandable. Thank you so much, Dr. Mubin and Dr. Ahmed. Thanks a lot for your help and support. So, Allah Hafiz. See you in the next video.